Welcome to Veteran to Veteran. I'm Conrad Kaskowski, and with me is Dwayne Wick. We're both members of the American Legion here in Plymouth. Dwayne's wearing a little different colored hat. He is actually the vice commander of the district in the area, and I happen to be the adjutant for the local post. We've had a little bit of increase in our viewership, and we actually had a viewer put in a request, and so we're going to honor that request, and you'll see what's going on in a few minutes. But let's get some very basic things here, Dwayne. For instance, I want to ask a couple basic questions. How many soldiers, sailors, Marines, and airmen are currently serving in the armed forces?
There are currently 1.4 million serving in the armed forces, and roughly that's 1% of the population.
Now this is going to give you a hint of what we're talking about. What are the numbers of the women serving in the armed forces?
Right, there are roughly 167,000 women serving.
Okay. Now, since our show deals with veterans, how many veterans are there? And I'm kind of expecting these numbers to be rather large.
They are, and these numbers, of course, change, and there are roughly 17.4 million veterans, and that's broken down into 15.8 million males and 1.6 million females. Now remember that that's the number that have served in the armed forces and are no longer serving. The median age of female veterans is 51 and 65 for male veterans.
Okay, we're dealing with some pretty big numbers, and now our theme for this show are female veterans. So dealing with that question, what is the very first question we ask any veterans?
Anytime I talk to a veteran, I ask them, are you enrolled in the VA care system?
Correct. So the basic care is available to all qualified to be enrolled in the VA healthcare system. Obviously, there will be more gender-specific care afforded to male and female veterans. Now that being said, what healthcare services are available to women veterans?
Okay, well, there's a full continuum of healthcare, including comprehensive primary care, care for acute and chronic illness, and gender-specific care, specialty care, health care, mental health care, disease prevention and screening, emergency care, and women's health special care. In addition, the VA offers such as inpatient medical, surgical, mental health care, physical rehab, substance abuse treatment, long-term care, and pharmacy benefits. Now that's a lot of benefits, a lot of things they deal with.
Okay, so now you know what we're going to be talking about. It's going to be called about the female veterans. So does the VA provide gynecological care, and what about breast care such as mammograms and breast cancer treatments?
The VA does provide a full range of reproductive health services necessary for the optimal care throughout their lives, including mammograms and associated cancer treatment. Gynecological and maternity care are available either at your VA facility or through referrals to the appropriate providers in the community. And this is referred care is covered by the VA.
Now, can a female veteran ask for a female clinical provider for her health needs?
Okay, good question. Yes, they can ask to be assigned to a female care provider on her team of her healthcare specialist.
Now, getting very specific, does the VA provide pregnancy care?
The VA covers pregnancy care typically through arrangements with community providers. And the VA will do prenatal care, delivery, and postnatal care for eligible women veterans.
You know, it's a question sometimes asked of why aren't babies delivered in a VA hospital?
Well, again, the VA covers the pregnancy care through arrangements with the community providers, and they will pay for the prenatal care, delivery, and postnatal care for eligible women veterans. And many details are involved with pregnancy care. Contact the Women's Veterans Program Manager as early in your pregnancy as possible to discuss local processes regarding prenatal care to explore your options.
Okay, so what about newborns? Is there anything for newborn care?
Yes, also the VA covers care for newborns for the first 7 days after birth of eligible veterans who are receiving VA maternity care.
Now, previously you talked or mentioned about mental health care. Now, for instance, if I'm in a crisis or to help another veteran, what do you do?
Well, the veterans have a crises line which is available 24/7, and that number is 1-800-273-8255, and press 1 to talk to someone immediately, or text 838-255 for a confidential chat. And again, that number is 1-800-273-8255, and then press 1 if you'd like to speak to someone immediately, or text 838-255 for a confidential chat.
Now, Dwayne, unfortunately, in the past few years, we've heard about situations involving women in the armed forces dealing with harassment and sexual assault. Where can a female veteran get treatment for conditions related to, well, combat trauma, for instance, because they are getting involved in combat more, sexual assault, sexual harassment that they unfortunately experienced while serving?
Okay, well, every VA medical care center does have providers who have the knowledge about after effects of trauma and evidence-based treatments for post-traumatic stress disorder and other conditions related to trauma. Veterans who experience combat trauma can access treatment at any VA medical center and most community-based outpatient clinics by asking their VA provider for a referral for mental health treatment, or by contacting the Women's Veterans Program Manager. And for those that remember this community-based outpatient clinic, we have one right here north of us in Cleveland.
All right. Now, we barely covered this subject, and so there are more questions, I'm sure. Sometimes we generate more questions with this show. So where do they go for help?
Well, we have many times mentioned our local Veterans Service Office, and to set up an appointment with them, call 920-459-3053. Again, that's 920-459-3053. And we also urge female veterans to check out the Veteran Administration website at www.va.gov and search Women Veterans Healthcare in the search tab. And there will be many topics, phone numbers, and other helpful information specific to the needs of the female veterans. And the female veterans is also the fastest growing group in the VA veteran population.
Okay. Now, I always like to throw in a little bit of history. And here in Plymouth, there is a history about women that have served in the armed forces, World War II. Second Lieutenant Julia Schmid Barnes was killed in action in World War II. in March of 1945. She was a U.S. Army nurse, and she was aboard a plane that crashed transporting wounded soldiers from the Battle of Mandalay. Now, she was a Plymouth High School class valedictorian in 1932. Wow. A little bit modern era. Lisa Poplinski Jaster of Plymouth, class of 1996. She's a graduate from the United States Military Academy at West Point. In 2012, then Major Jaster was one of the 3 women in the United States Army history to complete the Ranger School. The Ranger School is considered the most challenging school in the world. In fact, 51% fail. Locally, for Dwayne and myself, we have our current commander of our post, Kelly Wilfer, United States Army veteran. She became the first post commander in 94 years. So it took us a little while, but we got caught up.
In many other areas, the veterans are of leadership of our Legion is our female veterans.
Denise Rohan from
Viroqua
was the national commander.
National commander.
So finally getting some recognition. And I have to thank people that have been making comments to me via email about the show. So again, we got this topic from someone. So if you got something, let me know. And we'll look into it and try to help you out. So hopefully we'll have something for you new in the next show. Thank you very much.
Good night.